Okay, so I think what we'll do is we'll start with introductions. So welcome everyone. Thank you for being here and taking time out of your busy schedules to learn what we heard from folks in Washington County when we had conversations. We'll go around and do introductions on the screen and then let Sonia and Caitlin, and if someone else shows up in person, introduce themselves. And then we have some slides to share. I want to share a little bit about the project, what we heard from you all, and Aaron and Crystal are also going to share about the data and the information that we heard from people in Washington County. And then we're going to hear from our partners. Actually, I don't even see all of our partners here, so that could be interesting. But we have slides to share from our partners in Washington County to hear how they're working to address health in the community, and also what's coming up. And so how you can get involved is information that you can find out from them. And then Alia is going to wrap us up with what's happening next. So we'll get going with introductions. My name is Karen Henshaw. Again, welcome and thank you for joining us. I am the Associate Program Director for Connections in Health, which is part of Indiana Clinical and Translational Sciences Institute. And I will share more about that in the presentation. And I'm going to ask Aaron if he would introduce himself.
Yeah, good evening, everyone. Good to see everyone on the call. My name is Aaron Zitch. I'm a project management coordinator also with Indiana Ctsi, as we like to call it, as well as I do data collection, data analysis for the Connections in Health team that Karen will talk more about as well.
Thanks, Aaron. Crystal.
Hello, everyone. My name is Crystal O'Donnell. I'm a Doctor of Nursing practice student out of Rush University, which is in Chicago. And I am completing my clinical/practicum hours with Connection.
Thank you, Alia.
Hi, I am Alia Amin, and I lead the Cardiovascular Disease and Diabetes Coalition of Indiana under Connections in Health.
Great. Deidre.
Hi, I'm Deidre Miller. I play a couple of different roles. I'm Assistant Chief Medical Officer on Blue River Fire Department. And then I am also the counselor at the Salem office for Groups Recover Together, which is opioid treatment.
Awesome. Thank you. Welcome. And Connie.
Hi. Can you hear me?
Yes.
Oh, okay. I am currently the case manager at the Transitional Housing Project, Jill's House and Hope Manor for victims of domestic violence and sexual assault. And I'm also the coordinator for the Washington County Substance Abuse Council here in Washington County. And other than that, nothing.
All right. Thank you. And a dog mom, because we...
Yes, I am a dog mom. Yeah, I'm a grandma too, but you know, I can keep going on about all that.
All right. Thanks for joining us, Connie. Heather, would you like to introduce yourself?
Yeah, hi, my name is Dr. Heather Harden, and I am Assistant Professor at Case Western Reserve University. I'm also a lifelong resident of Washington County, and so I've actually done some research here. And I was just curious to find out what you guys did.
Awesome. Welcome. Melissa.
Hi, I'm Melissa Goforth Bell. I'm with Indiana Medicaid for Anthem. And I'm also a peer recovery coach. So I'm obviously really interested in a lot of things that you all are doing, and I'm excited to be here.
Awesome. Great. Thanks for joining us. Julia.
Hi, everyone. I'm Julia Brennemer. I am one of the SNAP Ed coordinators at the Indiana Department of Health. So I work very closely with Karen and Caitlin. So I'm excited to listen in on this today.
Awesome. Welcome, Julia. Caitlin.
Hi, I'm Caitlin Kudemeyer. I'm a community wellness coordinator for Purdue Extension's Nutrition Education Program. And I serve Washington County as well as 2 other counties. I'm going to work with community partners to implement policy systems and environmental changes to increase access and decrease barriers to physical activity nutrition, and food security opportunities. Thanks so much for joining us tonight.
And hello, also from Washington County, I'm Sonia Mitchell. I'm with Purdue Extension. I'm the Health and Human Sciences Educator. I provide the community education in the areas of food, family, money, and health. So I'm glad you all are here tonight, and hopefully you'll learn a little bit more about Purdue as well. Thank you.
Awesome, thank you. All right. I'm going to attempt to share my screen so that you can see the slides for tonight. All right. Now, I will tell you that I cannot see everyone when I share my screen. So if you have questions, feel free to put them in the chat and I'll make sure to get to them, or whomever can answer them when we get to the end of the slides. So thanks again for being here. I want to start by just talking a little bit about who we are so you kind of understand a little bit of background here. As I mentioned before, Connections in Health is a community engagement, part of the community engagement arm of Indiana Clinical and Translational Sciences Institute. You're going to get these slides later, as well as, goodness, I hope I don't trip over my words all night, as well as a recording, a link to the recording of this, so you can refer back to them if you would like to. And I want to point out that there are often links on the screen. So when you get the slides, if you want more information, feel free to click on those links and you can read a whole lot more. Oops. So Indiana Ctsi is a cooperation between IU, Purdue, and Notre Dame. And everybody plays really well in the sandbox together, and we're all collaborating on lots of important projects. There are lots of circles on the screen there that are bidirectional, just indicating that we have lots and lots of partners across the state of Indiana and even beyond. And sometimes they're asking us to work on something with them, and sometimes we're asking them to work on something with us. So the arrows go back and forth there. Basically, the translational piece is taking all that important research that happens and making it meaningful so that people in the community know what to do with that research information. So a researcher doesn't just get some exciting news and they find something and they publish it and then they move on to the next thing. We actually get to share what they publish and what that means for people in the community. So within Connections in Health, we have 3 statewide health coalitions. Those are the Hoosier Health and Wellness Alliance, which focuses a lot on food insecurity, nutrition, and physical activity. There's the Indiana Joint Asthma Coalition. There is the Cardiovascular and Diabetes Coalition of Indiana, which also includes stroke. And then the 4th piece in this puzzle is the Cancer Control, Prevention, and Equity Liaison. So we have a position with someone who doesn't necessarily have a coalition that they're leading, but they are the liaison between the IU Simon Comprehensive Cancer Center and all of our coalitions and the work that we do in the communities. So our job is to have a positive impact on health outcomes across the state of Indiana. And when this project came together in 2018, it was known that it's difficult to have a major impact in all 92 counties at once. So what they did, and Aaron was instrumental in this, put a lot of data together: health outcomes, county health rankings, life expectancy, social determinants of health, and ranked the counties, the 92 counties. And then we shared 23 of those counties with our partners that are in these puzzle pieces on the screen and said, where do you think we should go? And so they helped us rank the top 10 counties that looked like they had the most opportunity and willingness to partner, and maybe we're not distracted with some type of health issue that's outside of our focus area or chronic disease areas. And so these are the 10 counties on the map that we are engaging with in the first 5 years-ish of the project. The counties that are blue include Vermilion, Grant, and Blackford, and those are the counties that we have already gone through this process with. The blue county at the bottom is you guys, that's Washington County. And it's green because that's where we are sharing back information and hoping to build relationships and hoping to share evidence-based research practices, strategies and interventions to help address whatever health challenges the community decides they would like to address. Lake and Madison counties are yellow because those are the two communities that we will be engaging in soon this year. And then we have the red counties, Stark County, Marion County, Clay County, and Jennings County that our counties will be working with in 2023 and 2024. So trying to make a difference, building relationships one county at a time, so we actually have time to get to know you, get to know the community, what your priorities are, and join some of the groups that are working to improve health. This is what our Connections in Health overall membership map looked like in July of 2021. I show this to you because I think it's important to realize that we have members from all over the state. There are a few counties there that are gray, and hopefully we've filled some of those in with some members since July. But we've got experts all over the state. And so when Washington County says, this is the challenge we want to address, a lot of times there are people across the state who may have had experience addressing that. They might be able to help move that forward and share their expertise. Oh, I forgot to change the slide. Sorry. I think I'm going to turn it over to Aaron here.
That works just fine. Thanks, Karen. I just want to kind of jump into some of the stuff we heard from folks as we started talking to people in Washington County. And I'll get a little bit more into detail about how we went and talked about, how we went about talking to folks, but who we talked to is important as well. We wanted to make sure we were covering a wide variety of areas, folks who represent different sectors of work and, of lives. And so you can see here is a couple of the sectors that they identified with after we talked with them. Folks in healthcare systems, folks in community-based organizations, and then community members were among the most of the folks we talked to, as well as a couple folks from local government, educational systems, businesses, not as many from statewide or national organizations, and then also one from military. And military is a focus that we're putting a emphasis on as Connections in Health overall, to really expand our membership to really encompass that population a lot more. So if you want to go to the next slide. So we had a couple ways with which we talked to folks. The first thing that we did was a survey. So I'm sure you've all done a million surveys, but this was one more. But Sonia and Caitlin did a tremendous job of distributing this throughout Washington County, and we had 170 responses, which was awesome. And it gave us, one, a ton of information, but two, a ton more people than we even knew of to reach out to talk to have what we called listening sessions. And so we had 48 listening sessions. Those were one-on-one or maybe a couple people where they talked to a representative from our community engagement team. And we went through, what are some of the challenges? What are some of the successes within the community, to really get to understand, what's already happening within Washington County, and where are areas that the residents or people who are deeply engaged within the community feel that, there's room or actionable change that can happen with certain challenges. So we had 170 do the interest survey and 48 people who participated in the listening session. So those are where all of this information that you're hearing tonight came from. Like I said, like Karen said, we've been engaged with Washington County for a couple months, and all of these listening sessions have happened throughout the last couple months, and now we're sharing that information back. So before jumping into, yep, you're perfect, you nailed it. Before jumping into what all we heard, I kind of wanted to give some context to some of those chronic disease conditions that we talked about. So as we mentioned, there's 3 chronic disease initiatives within Connections in Health, and those are the areas where we feel we can, provide the most resources, provide the most assistance to really make some sort of change. And so I wanted to kind of see where Washington County stands right now. So among some of those conditions, Cardiovascular Diabetes Coalition of Indiana covers heart disease, diabetes, stroke. So we can see in Washington County, heart disease is higher than average in Indiana. Diabetes is just slightly above average, as well as stroke is higher in Washington, especially among women. The Indiana Joint Asthma Coalition also works with asthma and environmental impacts. So lung cancer is also impacted. Asthma tends to be about 10% throughout most of the state, kind of higher in certain more urban areas, but is slightly higher in Washington County at 11%. Lung cancer is higher, both men and women. Breast cancer is actually below average in Washington. And then we have the Hoosier Health and Wellness Alliance, which covers obesity, nutrition, physical activity. So physical inactivity, about 4% more people within Washington County are more physically inactive than throughout the state. Food insecurity is actually slightly below average, which is great. Obesity is above average, 2% above. And then a big one here is access to exercise opportunities is significantly lower than the average throughout the state. So that almost 30% less people that have access to exercise in the state. And that's not to say that any of this is a bad thing, but it also just indicates, hey, there's perhaps room for improvement, and there may already be folks who are already working in these areas that Connections in Health can, provide some resources to and work alongside in those initiatives to kind of help them along. So with all that said, we heard a lot of really good things throughout the community. We heard a lot of successes. And so again, I'm going to go by each of those coalitions and initiatives to kind of say, here's what we heard were successes that we could also try to build off of as we move forward with these. So shout out to our Purdue Extension program. The Dining with Diabetes program was a success. There's been increased screenings for hypertension within the community, as well as A1C levels increasing in clients is what someone mentioned. In Salem, rehab facilities for heart issues are strong, as well as plenty of opportunities for educational opportunities for diabetic care. We also heard that nutrition resources for diabetics was great in the community as well. The next slide will talk about kind of the cancer and tobacco focused successes. The Tobacco Coalition within the community is extremely active. Interventions with tobacco marketing and education, increased screenings for lung cancer. Sounds like there's a plethora of screenings that have been going on within the community. Again, talking about the coalition, there's lots of engagement and partnerships with the coalition. And then one thing we heard a lot was the Tobacco Quit Line is a wonderful resource within the community and has a lot of use as well. The third one is nutrition and food security. We heard plenty about all of the local food banks that are working so hard to keep people in the community fed. Walmart being a large contributor to those food banks. Nutrition and wellness classes offered by Purdue Extension. The Community Health Action Team, who is focused on increasing physical activity and nutrition. The wellness fair that was held this past November in partnership with the Center for Rural Engagement. Utilization of those food banks is increasing, as well as First Christian Church hosting a community meal twice a month. And then the last one related to the coalitions, and then there'll be one more, is creation of different walking programs, biking trails, walking trails, outdoor exercise equipment. The schools having wellness programs starting to promote healthy living. And then again, echoed many times was the YMCA and how integral it is within the community among health and wellness initiatives. And then lastly, there were a couple things I wanted to highlight that didn't quite fit into all of these coalitions, but were also big successes. Depression screenings being provided for the senior renewal program, the federally qualified health center in Life Springs, lighting within local parks, Students Against Destructive Decisions programs within schools, and the Queer Straight Alliance having great success. So these are a lot of places where, folks in the community said, these are where we're succeeding. These are where, there are groups who are working within the community and doing a great job. So that's it for me. And then if there's any questions later, more than happy to take any, but I'm going to pass it off to Crystal for now.
So hello, everyone. So I did a assessment on Washington County in comparison to the Midwest region, Indiana, and United States. It was very extensive, so I can't share all of that information, but I did want to talk about the 5 leading causes of death. So off to the left, list out the 5 leading causes of death. And it also provides towards the right, Washington County, Indiana, and United States. And I have 2 time frames in there. The first one being from 2016 to 2017, and the second one being 2018 to 2019. And the numbers listed are the number of deaths per 100,000 people. And that's just a way to compare different areas. And if you click the next button, Karen. Thank you. So when you look at Washington County in comparison to Indiana and the United States, and looking at over time, the disease of heart, malignant neoplasms or cancerous tumors, and unintentional injuries are 3 causes of death that have not only increased in Washington County over time, but also are much higher than the leading cause or the number of deaths for the state of Indiana and the United States. So like disease of the heart, there's 264 per 100,000 people, where Indiana is 216 and the United States as a whole is 200. So it's just a big difference between those different areas. Aaron mentioned earlier the interest surveys and that there was 170 of those that were completed. Some of the challenges that were expressed during those interest surveys are shown below, with diabetes, physical activity kind of being at the top 2. But then there are also cardiovascular disease, cancer, and nutrition kind of similar in regards to mention of challenge. Then when you go to those listening sessions, which there were about 48 of those, similar but slightly different in regards to what was brought up most often in regards to the challenges. So both cardiovascular disease, diabetes, and food insecurity were the top 3 that were listed. This slide kind of goes more in depth about the challenges. So it includes any challenges that were brought up during those listening sessions. And this is a word cloud. So the larger the word is, the more frequently it was brought up. So there's a lot of information on this slide, but it looks like diabetes kind of was frequently brought up, but very close to nutrition, not physical active, heart disease, poverty. So they're very similar. Next slide kind of pulls out just the challenges that are specific to connection and health, which Karen brought up earlier in regards to those initiatives that they have. Again, diabetes kind of stands out the highest in regards to that. Nutrition, heart disease, and not physically active are larger words as well. And then this slide kind of groups those words together a little bit more. So on the previous slide, nutrition was brought up in various different ways, which include just nutrition in itself, food deserts, knowing how to cook healthy, not much fast food options, or too much fast food options, sorry, and nutrition education. So kind of grouping those all together, and same with physical activity. There was 2 that were brought up, both physical activity and people not being physical active. So bringing those together. So when looking at this word cloud, obviously nutrition was brought up more frequently in regards to the concerns. Now, both this slide and the next slide kind of go more into the details of what was discussed in regards to the challenges. And as Karen mentioned, these slides will be shared with everybody, so you'll have all of that information. But it just covers a lot of the different things that were brought up during those listening sessions.
So I broke the rules, the PowerPoint rules, that you don't put this many words on a slide. I just wanted you to have them so that you could look through them when you get them. I'm not expecting you to be able to read all of that right now. But when you have a chance to review the slides, you can see some of the exact challenges that people were mentioning when we had conversations with them. So now I'm going to turn it over to Sonia so that she can share more about Purdue Extension. And we're going to move into the section of tonight where we hear from our community partners. So Sonia, it's all yours.
All right, thank you. So yeah, let's let you know about Purdue Extension here in Washington County. A lot of people still don't know that we're here, and we provide a number of services to the community, typically either free or at a nominal fee. I'm the Health and Human Sciences educator. You can certainly contact me or call me because I provide education in the community around the areas of food, family, money, and health. So those are my 4 basic areas, anything related to food, if it's nutrition or if it's even wanting to know how to work an Instapot, families, like our Strengthening Families program, money management, teaching children and adults, and with health. Obviously, one of the programs we just mentioned was the Dining with Diabetes, but we have it about mindfulness, your brain health, just a variety of programs. And these are some of the ones I just mentioned that are very popular in the community. Some of you may have attended them or know about these. Dining with Diabetes is absolutely on point as it's a major concern within our community. Also, Be Heart Smart as we're struggling with good heart health. And recently we've added pasta to that, and that's not a food item. It's actually parenting the second time around because we're finding in our community we have a lot of parents struggling to raise their relative children. They may be other adults, not in a biological parent, but in the parenting role. And here are some upcoming programs that we have already scheduled out through this next month and through March. And we'll be adding to that. Yeah, and I just wanted to let everybody get an idea. I provided this infographic to let them know about the impact that Purdue University is having throughout the 92 counties in Indiana. So we're doing good work. We just want the community to use us even more than they do already.
Okay, and then I'll talk a little bit about the Community Health Action Team. As a Community Wellness Coordinator, one of the first things we do is assemble a team to look at and examine health rankings, challenges, opportunities, things like that. So the Community Health Action Team was established in 2016 with the primary focus to get those assessments done. But from that, we have grown into a group that meets monthly that envisions a community that is safe and healthy for all while promoting physical, mental, and emotional wellness. And then we have members from a variety of community groups. We have community members, healthcare providers, mental health providers, governmental agencies. Our local library system is on the action team, insurance companies, universities, social service agencies, as well as some of our fitness centers. So we really have a wide range of people on the chat team. And in 2022, these are some happenings that we will be promoting. So we'll continue the promotion of the Washington County Park Hop. We started that last year, and we had approximately 482 community members get a park hop passport and go visit some of our local parks. We'll continue our partnership with Connections in Health to address chronic disease within the community. And so you all being here is one step to allow us to continue that partnership and really understand what the needs of the community are. We'll continue to host Walktober, which is a month-long physical activity and walking challenge in October. The group would like to research how to become a trauma-informed community and potentially implement some of the teachings that we learn. And hopefully some of our social service organizations can become trauma-informed. And then we plan to offer a nutrition prescription program in partnership with Lost River Market and some local healthcare providers in 2022. So we'll start with a pilot program in March, and then in June, we'll launch a 20-week program focusing on nutrition, physical activity. So we're excited for that. And then if you want to join chat, we welcome you. We meet the third Thursday of every month at 2 o'clock, virtually and in person. And to learn more about that, you just contact myself or Sonia. We co-facilitate that team, and we would love to have more people there. Okay, and then I don't think Rhonda's here today, so I can go through her slides for her. Rhonda is the Washington County Tobacco Prevention and Cessation Coordinator. It's an ISCH community partner, and it's sponsored locally by Hoosier Hills Pact. Karen, if you can go to the next slide. Karen, can you go to the next slide, please? Or maybe you are, and I just can't see it.
It looks like she might be frozen.
Okay. I'm sorry, I don't have Rhonda's PowerPoint with me, so I can't read off of it. But while Karen gets back online, I'll just say we're excited for you all to be here, and this is a great first step into really putting health first in the community. So I'm excited that you all are here and that you filled out those surveys and listened to or provided your feedback in those one-on-one listening sessions. Karen, you can jump to the next slide. Thank you. So these are the priority areas of the Tobacco Prevention and Cessation Program here in Washington County. Number 1, to decrease tobacco use among youth and young adults. Number 2, increase Hoosiers not exposed to secondhand smoke. Number 3, decrease the adult smoking rates. And number 4, maintain state and local infrastructure necessary to continue the work in eliminating tobacco addiction and exposure. And then as you see, this goes back to the priority 1, decreasing tobacco use among youth and young adults. And so some of the ways that they do that is to focus on educational activities on how tobacco products are priced and marketed to teens and marginalized populations. And so in 2020 and 2021, the coalition had a partnership event with a PowerPoint presentation to several different groups of youth within the county, and they reached 550 youth and adults. And then they also worked on the standardized tobacco assessment and retail settings team, and they completed the retail assessment on how tobacco products are priced and marketed. And they reached 25 retailers biannually, and they were one of 35 counties to participate. And then priority area number 2, they worked on Breathe Easy Salem by trying to pass a local ordinance to protect all workers from secondhand smoke, including those in bars and clubs. And they started this in 2016 with the Breathe Easy Salem Committee. And then by generating over 1,000 supporters through cards and then organizational letters of support. Then they also presented during a Salem City Council meeting, and the council sponsored and council members supported it. 2 out of 3 of the council members supported the Breathe Easy Salem initiative. And then you'll see here the number of users that call the tobacco quit line. Washington County was in the reach for top 10. So that was great that so many users from Washington County were reached. And then this just goes into where or what quarters in Washington County was a top 10 reach list member. So you'll see for several quarters from 2017 all the way to 2021, Washington County was in that top 10 list. The current smoking rate for Washington County is 29.8%, which is about 10% higher than Indiana. So there's still a lot of work to do. The tobacco industry targets certain communities and geographical areas, including rural areas. And then the smoking rate during pregnancy is 12% in Washington County versus Indiana's 11%. And then priority 4 of that coalition includes activities with existing partnerships, some outreach to different populations, media campaigns, some were paid and some were earned, new partnership outreach and activities through the coalition, educating and thanking state and local policy makers in regards to the program. And then they have several Breathe program partnerships with entities such as Hoosier Uplands, Early Head Start, Bright Futures for Family, Hoosier Hills Pack Shelter and Transitional Programming, and then Choices Life Resource Center. And then partners can use any or combined components of the Breathe program. And then if you want to get more involved with local tobacco control, my first thought would be to get a hold of Rhonda. She is the tobacco control rock star and really has a passion for this work. But you can also work with youth or adult focus prevention, join the Indiana Quit Line Preferred Network, learn and share information on the harms of secondhand smoke, or even join in establishing a tobacco-free campus policy, be a Breathe Easy Salem supporter through multiple means, become a Breathe Healthy Steps to Living Tobacco-Free program partner, or offer contact information for new partnerships.
All right, next up we have Choices Life Resource Center. They're here in Salem, obviously, and they also have offices in New Albany and Corydon. Rose Condra is a contact person there, and she couldn't be there with us today. But they offer medical care for pregnancy. They have counseling. They have services for sexual health related services, and they have wonderful setup to obtain free baby supplies. I think you'll really appreciate their Step Up to Parenting resource program. And this organization is just wonderful for anyone that walks through the door. They don't require income checks, no explanation. If you need something, then they're there to work with you to see that you get it. All services are free and confidential. And they can provide pregnancy services in the terms of a test. They'll help you kind of plan out your care for your pregnancy. They have the ultrasounds and they have additional medical services. They keep expanding over there to even offer more services to their pregnant women. And they also have sexual health services there. Again, counseling and STI testing is something that they can provide. You may have to pay a small lab fee, but otherwise their services are free. And their parenting resources really are phenomenal there. They have offered classes. They partner with a number of people, including in our nutrition education program. I've been there when they've offered nutrition education along with a cooking demonstration. I've been there to help with parenting classes such as block parties so that parents understand the importance of play in their children's learning. I've also been there to work with moms on money management with a program called Where Does Your Money Go? And clients can earn these boutique bucks to spend and attend any of these educational programming, and they get these bucks that they can go in and buy the supplies they need for their baby, anything from excuse me, formulas to diapers, car seats, and more. Just whatever you need, they will make sure that the child and the parent are able to get what they need.
All right, thank you, Sonia, and
thank you
for sharing. This person, I feel like this is a broken record. This person couldn't be here tonight either. She actually got stuck out east in the weather. So Cass Boss is the person who put these slides together. And hopefully you are aware that there was a wellness fair in November of 2021. And so they wanted to share, there's a group meeting planning another health fair in a wellness fair in April. And they wanted to share information from the first one. So from November, there were 41 students that participated. There's a lot of faculty from IU Bloomington and students in their classes that are participating in this health fair and providing screenings and services. 49 residents were screened. A lot of the students and some faculty staff were also screened. So an opportunity for them to get through some screenings as well. Some of the successes, they built more partnerships for future opportunities, helped increase health access to Washington County residents, increased awareness and education regarding health and well-being. The students that were involved had real world hands-on experience and team-based opportunities. And there's also a model now for future wellness fairs for Washington County. So they also did a survey of the folks who participated in the wellness fair. 56% of the people that filled out the survey indicated it was the first time they had attended a wellness fair. 100% said they would attend a future wellness fair and they would recommend this to friends and colleagues. That's pretty good. You can't get better than 100%. 98% liked the location, thought there were sufficient resources, and they were better able to understand health and well-being as a result. Overall, 96% rated the fair as excellent, very good, and 2% rated it as good and 2 as fair. So here are some other things that went well as some areas to improve. From the participants' perspective, people were kind and informative and helpful, and it was a really good experience. From the partner perspective, so the people who were providing the resources and screenings, they appreciated the refreshments, the student guides, and also the leadership planning and organization. There's a lot of teamwork that goes on with this group that's planning the next wellness fair as well. Different things that could be improved: wait times, especially the nursing station. So evidently the screenings there were well attended. Transportation, advertising, getting more community partners involved, having it open for longer times, having backup equipment in case something malfunctions or fails, having areas in the same building so people don't have to go outside, and using a more central location in relation to the town. This is information about the next wellness fair. It's on April 9th, 2022. It will be from 10 to 3 at the Salem YMCA campus. And if you would like to get involved, please do contact CastBots. Her email is there. It's botsk@iu.edu, and she can tell you how you can get involved. And now I'm going to turn it over to Alia.
Hi, everyone. So I'm the lead for the Cardiovascular and Diabetes Coalition of Indiana. And as mentioned, we have some funding for a community funding project in the Caddy areas. So as Karen said, we focus on cardiovascular disease, diabetes, and stroke. So I just want to tell you a little bit about our process so that you can get involved. We will be holding 3 town halls. One will be for community members, one will be with providers, and then a third one is where we will bring everyone together to discuss ideas and focus areas for our project. These are going to be towards the end of February, so you should be seeing that information. It's already out there, but if you haven't seen it yet or signed up, you are welcome to do so, and we would be happy to have you. So again, the goal is to create momentum for a project. We want something lasting. We can help enhance an existing project that is working well already, but maybe just needs a little bit of support, or we can come up with something new to tackle one of these areas. So we really want to hear from you. We want this to be a community-led project, and we're just here to help and assist. And again, here is a flyer for the town halls. So the provider one will be from 11:30 to 1, and the member one will be in the evening. But if for some reason one time works better than the other for you, please just sign up. We would love to have you at either session. And we can't do this project without you all. So join us, and we would be really excited to have you.
Okay, thank you everyone for your patience, especially when I departed for a few seconds and had to come back on. Sorry about that. Rural internet situation. We just wanted to open it up to see if anyone had any questions, anything that you would like more information about, anything that wasn't clear.
Hey, this is Heather Harden. I was just wondering, how did Washington County get selected to be a part of this program? I know at the beginning you showed the state of Indiana, and Washington County was the community IU was currently working with, and they had some future plans. And I was just wondering, how did your group identify which counties they were going to work with?
Yeah, great question, Heather. So we first looked at the data and narrowed it down to the top 23 counties in the Indiana area, and then asked our partners, where do they have existing relationships and partnerships? Where do they recommend that we go? In addition, where do they recommend we not go? Because there may be other hot topics that are happening there that are not related to our chronic disease areas. And so we might be a burden. And then I will tell you too that Sonia and Caitlin had a lot to do with it, because they invited us. They said, hey, we know that we're on your list and we would really like to work with you and like for you to come work with us. We have the community health action team already, and we would like for you to come and support us. And Aaron also, I can't get to the chat box. There we go. Aaron also mentioned in the chat the data was largely based on health outcomes related to our chronic disease areas. So asthma, tobacco use, cancer, diabetes, cardiovascular disease, stroke, obesity, food insecurity, physical activity opportunities, those types of things were a lot of the data points that we were looking at. Does that help, Heather?
Yeah, no, it absolutely does. And, I agree. Washington County certainly is, has a lot of needs in a lot of those areas. So what are like the main goals of your program at IU? Is it just to help coordinate services, or, and maybe how long does it last?
More great questions. So the project started in 2018 and it was late. It was like October of 2018. So the first year was really spent getting people hired and acclimated to the coalitions and the project. So really we didn't start engaging until 2020 with Grant and Vermilion County, and we're still working with them. So it's been 2 years working with them, and we're still in those communities working with them on the projects that they're wanting to work on. We're also working in Blackford. We're just starting to work in Washington. So it's it should be a long-lasting relationship. That is our hope. And our hope is that we can get one project implemented with the community funding, and then people will still invite us and include us and think of us when they are, looking for a project or wanting to help to identify community readiness or other research-based strategies and interventions to help improve health. And overall, our main goal is to have a positive impact on health across the state of Indiana through coalition work. We know there's a lot of synergy that can happen when you have a group of people working together toward a common goal. And so we're really interested in working with coalitions that are already in existence, or helping build coalitions or strengthen them, and provide resources for coalitions to use as well. So, and I didn't answer one question because I don't really know how long it will be.
Okay, yeah. So have you guys selected your priority topic? I know you guys listed a lot of topics, and I mean, there are a lot of needs. So I was just wondering if you'd selected your topic, or how will you select that?
Yeah, so the next steps will be in February, those town halls to specifically talk about addressing something related to cardiovascular disease, diabetes, and or stroke. And then there's funding to support whatever that strategy is that the group wants to implement. And then as far as the other items, our coalition leads and our coalition members are hoping to join forces. So our Indiana Joint Asthma Coalition lead will probably join the tobacco. Actually, I think she's already been participating in the Tobacco Coalition, since we know tobacco and asthma don't play well together. So hopefully we'll be able to join the groups that are in existence and continue to help share data and identify strategies that the community wants to use to address the challenges that they choose. I like your question.
Yeah, no, thanks. Thank you so much for answering my questions. I thought what you guys were doing is really interesting, and glad to have you guys around here. Fun out.
Great.
Appreciate it.
Thank you. We're glad to be here. It's a lot of fun, and it's very energizing to find people who are interested in improving health in their community, and maybe even just increasing awareness, because sometimes we only know what we know, and sometimes people don't even realize, oh, that's not a healthy habit. Maybe I should try something else. Anybody else have questions? Or Heather, do you have any others?
No, I don't have any other questions. Thank you.
Okay.
Thanks for taking the time to answer them.
Sure. Any other questions? Okay, so you probably, if you registered ahead of time, you should have gotten an email earlier today that said, hey, today's the day, here's what's happening, here's where you can park if you're going in person. At the bottom of that message was information about the town halls in February that Alia just talked about. So if you would like to join those and be involved, please visit that email and click on those links, because we would really like to have your insight. That will be in interactive. Those will be interactive community town halls. They will not be like this. You will not be talked at. You will be asked questions, and the group can respond to those questions. They are really fun and fabulous facilitators. I guarantee that you'll enjoy it. It's also really interesting to hear what other community members think are some concerns and specifics about that concern that they share. So I hope that you'll consider joining us there. Next steps look like this. There will be those town halls. And the third one, so two of them will be very similar. One is for community members, one is for healthcare providers. Sometimes we know those groups have different views. And so we wanted to provide an opportunity for all of them to share. The third town hall then is, it's decision-making time. It's time to decide, what do you want to address related to diabetes, cardiovascular disease, and stroke. What's the challenge that you want to address? After that, Crystal is hopefully going to be able to do some community readiness interviews with different people in the community Our target is to do 10 of those. She can then compile the data, and we use a tool from Colorado State, and it tells you what level of readiness the community is at for addressing a specific challenge. So from there, then it'll say, okay, this is the level of readiness. And so here are some suggested interventions. And then we are hoping to provide some evidence-based strategies that have worked other places to address the challenge that you all select, and kind of let you decide, you know, where do you want to go from here, and how do you want to spend those funds, and how can we help? So that's what the plan is, the timeline. We would love for you to have an idea of a project and some movement this spring, and the funds to be spent by the end of June. So if that gives you an idea of the timeline. We also are hoping to work very closely with Caitlin and Sonia and the Community Health Action Team, and not necessarily start another group, but also just work with the groups that are existing. And then we're hoping to also work with some of the other groups that are around. And if you are aware of other organizations or groups that you think would be interested in working with us and receiving some of our support and resources, please don't hesitate to connect us, to reach out to us, introduce us, and we're happy to also work with them. If nobody has any other questions, we're going to let you carry on with your Monday evening and have a fabulous rest of your week. Thank you so very much for taking time out of your Monday evening to be with us and to learn a little bit more about what we heard.
Yeah, thank you so much. Good night.
Thank you. Good night, everyone.
Thank you.